Hi, my name is Alice, and I'll be presenting our work on domain adaptation and self-supervised learning for surgical margin detection at IPCAI 2021. Breast cancer is the most prevalent cancer in women worldwide. Breast-conserving surgery, known as BCS, followed by radiotherapy, has become the standard treatment for early-stage breast cancer. The goal of BCS is to remove the tumor completely while preserving as much healthy tissue as possible. The presence of cancer cells on the resection margin, referred to as a positive margin, indicate incomplete tumor resection. Positive margins are often correlated with an increase in local and distal recurrence of cancer and demand repeat surgery. Currently, margin assessment is performed by pathology following the surgery. The current standard of care can lead to waits up to 2 weeks to receive pathology confirmation and see up to 40% of women require an additional surgery, costing an additional 35 million Canadian dollars annually. These repeat surgeries also lead to poor cosmetic outcomes and are associated with psychological distress for the patients. So the purpose of our work is to address this gap in the care for breast cancer patients. Ideally, the evaluation of resection margins should be done in real time to allow for immediate surgical adjustment. The intelligent knife, also known as the iKnife, is an innovative device that utilizes rapid evaporative ionization mass spectrometry, also known as REAMS, to address the challenges surrounding real-time margin assessment. This device, combined with a recognition model, would be able to perform what we call intraoperative pathology and give almost immediate feedback to the surgeons, allowing them to address positive margins within the same surgery, and hence reducing the rate of repeat surgeries and delays to life-saving therapies. One of the main challenges faced when developing a real-time tissue detection model with the iKnife is the collection and labeling of training data set. The destructive nature of the iKnife via electrocautery causes two major challenges. First, data collection is limited to certain patients with larger tumors that will produce larger excised specimens. This is to control the location of the point burns to avoid compromising pathology. With national breast screening programs in place for a few years, there are increasingly fewer patients with large breast tumors. This is an achievement in women's health, but minimizes the opportunity for sampling tissue characteristics in tumors. Second, once a burn is collected, the tissue no longer exists, as you can see here from the short clip. For labeling purposes, the pathologist must make an educated guess as to what was once present based on the remaining surrounding tissue on the histopathology slide. These two challenges result in the data acquisition process becoming time-consuming and expensive, while label generation is subjective, which results in weak labels. In this study, we propose to use domain adaptation and self-supervised learning to build models from limited, weakly labeled data. We therefore compensate for our lack of breast data by using data from a more easily accessible tissue type, basal cell carcinoma, to train a model on the shared features of the iKnife. BCC is a form of skin cancer that rarely metastasizes and has a very high incidence rate among the population. Once the model is trained using self-supervision, the weights are transferred for fine-tuning and classification of our target task, breast cancer recognition. We can take advantage of BCC dataset because ambient mass spectrometry has been shown to be useful at measuring metabolite changes in tissue, processes that are linked to cancer growth. In general, mass spectra of biological tissue can contain several classes of molecules, regardless of tissue type, with an approximate mass charge ratio subbands, such as fatty acids and small molecules, phospholipids and other structural lipids, and triglycerides. Therefore, learning these general signatures in self-supervision step first, as presented in this study, would be beneficial. In addition to this, the iKnife can also reveal distinct molecular profiles that vary between tissue types. Ratios of peaks within and between these classes can be used to provide high-level mass fingerprints and differentiate between tissue types during classification. In our study, domain adaptation from skin to breast was therefore feasible due to the similarities in profiles between skin tissue in general and breast cancer, and not because skin cancer exhibits specific common profiles with breast cancer that were related to malignancy alone. In this scenario, the pre-training on skin performs the ideal initialization and generalization of the weights and helps avoid overfitting to our relatively small breast cancer dataset. For the self-supervised learning step, we used a relative patch algorithm, an example of which is shown here, where the model learns features of the input by first dividing it into a set of patches and then predicting the context of that patch relative to the others. We divide each of our spectrum into n patches, resulting in n factorial possible permutations. So 6 patches gives you 720 permutations. One at a time, a particular permutation is used as an input to a deep model. The model we had 5 convolutional layers and leaky ReLU activation. Each patch is passed through the convolutional layers individually. The output of the convolutional layers are then concatenated and go through 3 linear layers prior to final classification layer. Through the reassembly of the shuffled inputs, a model can learn to recognize patterns, shapes, and textures of Reams data. In the context of Reams, the placement of these peaks at certain MZ ratios and the intensity relationship between different peaks across the spectrum can be chemically significant. Learning is performed without consideration of tissue labels, but instead only the permutation labels at this point. So using our patches, features are learned through reconstruction of the input in the self-supervision task. These features are then transferred to the classification task. We devise a new model with similar architecture where the final weights of the convolutional layers of the self-supervision task are frozen and used. The 3 linear layers that follow are resized for binary classification. The model takes in a spectra as an input patch, but in its original arrangement with no permutations. The linear layers are then retrained to classify breast cancer versus normal breast tissue. We first want to study the influence of the self-supervision task via visualization of the latent space. So we perform TS&E dimension reduction on the input data. These figures depict the distribution of the data from breast and skin in their original space on the left and the latent space of the self-supervision model on the right. The right figure is after we train the self-supervision model on the skin data, we run both data sets through the convolutional layers and display the distribution of the latent space. As expected, the breast data, which is yellow on the left, clusters separately from the skin data in the original space. But after self-supervision training, the task results in a more evenly distributed data. This is important to see as these weights are kept unchanged for the subsequent classification task. This suggests the potential of learning shared features from skin and breast data. An example of these shared features would be the ionized particles of cell membranes, which both tissue types would have. Domain adaptation from skin to breast is therefore feasible due to the low-level similarities and profiles between skin tissue and breast cancer. We then investigate the effect of patch sizes on the performance of our approach. To recall, the number of patches dictates the number of possible permutations in the spectra, which is also the number of classes for the self-supervision task. Here we report AUC as it takes into account accuracy, sensitivity, and specificity in a compact representation. We report the performance of the classification task as we are only interested in learning how the self-supervised task translates to this subsequent classification. The number of samples across the x-axis indicates the number of labeled breast samples used for training the classifier. Each sample was randomly selected from a pool of training data. Dividing the data into 6 patches leads to the highest classification performance in almost all cases. The standard deviation of the 6-patch model is really high for the tan sample training on the left. This is probably because the other 2 models benefit from a lower number of patches, which means a lower number of permutations to be learned. This decreases the complexity of the architecture and increases the stability of training with a small number of samples. Since the 6-patch models show the highest performance, we use this configuration for the rest of the experiments presented here. Having chosen the model architecture, we can now investigate the data sets that we chose to use and in what capacity. This table shows breast cancer classification performance given the self-supervised models described in the leftmost column. The validation set is important to self-supervised learning because during training, the best model was selected based on validation set loss. We show here that the proposed method using skin for pretext learning had a significantly higher AUC than both the breast-only model in the last row and the dense baseline in the last table. We found that using breast data as a validation set in the self-supervised task increases the diversity of the data that facilitates domain adaptation for classification task. We also compared our model to a baseline model. This baseline model is less complex than our compared to our proposed approach and has fewer parameters to optimize, as seen here. This model was trained using only breast data, so no domain transfer. The model performed relatively poorly in its ability to properly classify cancerous burns, so the sensitivity value. This indicates that proper inclusion of skin data in pre-training followed by domain adaptation can help better generalize for breast cancer classification. Finally, we wanted to examine the biochemical significance of our model's activations and attentions. These activations are captured by the last convolutional layer of the classification model using GradCam. The red boxes outline areas that have been reported to chemically influence the differentiation of breast cancer. On the top, we have 9 breast tumor burns from a test fold, and on the bottom, 24 normal burns from that same fold. St. John and Al focused their study between 600 and 1,000 mass charge ratios for breast cancer classification using Reams data. They reported 2 significant subbands for their classification, one of which is the phospholipid range from 670 to 800, and the triglyceride range from 860 to 940. In our work, we can see some distinction between the 2 activation patterns of tumor and normal breast tissue. In a study by Santoro and al., DESI was used on perioperative breast tissue slides for tissue differentiation, and they reported that the mass charge ratio of 281 as one of the ions that stood out in their analysis. Although REAMS and DESI have different acquisition systems, which may affect whether ions are detected or not, the mass charge ratio values of detected ions would remain in the same range. A final area of interest exists around 550 with a high activation for cancer spectra. This area lines up with the lock mass peak used for REAMS calibration at 554. Although this peak is also present in normal REAMS burns, it usually is overwhelmed by the other high intensity peaks in the normal breast spectra. Breast cancer burns tend to have overall lower ion counts, and therefore the normalization in our pre-processing may further highlight this peak in the tumor burns and not in the normal burns. Overall, we show that our two-step classification network is learning patterns that have relevant chemical significance and agree with other studies in the literature. We developed a self-supervised learning approach to contextualize the general biochemical features of tissue by taking advantage of data from a more accessible tissue type. Through extensive experiments, we demonstrate that for successful classification, self-supervision acts as an ideal initialization, compensating for the lack of ample breast cancer samples. To the best of our knowledge, this is the first application of domain transfer for the iKnife and the first adaptation of relative patch algorithm for self-supervision in 1D signals. Although we believe that the structure to be well suited for small data sets, it's also a limitation of our work. In the future, we hope to confirm this performance by collecting new breast cancer samples and extending it to incorporate other cancer tissues, such as colorectal cancer. I'd like to thank everyone that made this work possible and has been part of all of the studies that have supported this work. I'd also like to thank our financial partners. Thank you for coming and listening to my presentation.